Hello everyone, my name is Araceli Delgadillo, and the title of my presentation today is The Effectiveness of the Mediterranean Diet for Weight Loss, a Systematic Review. The objectives for this presentation is to review and understand the current research on the effectiveness of the Mediterranean diet for weight loss, and how these findings can be applied by nutrition professionals. So first off, we will start off with a background on the Mediterranean diet, which is a way of eating that's based on traditional foods and drinks from the countries that surround the Mediterranean Sea. So for example, the countries of Italy and Greece. The Mediterranean diet consists of a plant-based eating plan that includes daily intake of whole grains, olive oil, fruits, vegetables, beans, and other legumes, nuts, herbs, and spices. And traditionally, the Mediterranean diet is prescribed to those who have heart disease or who have high blood pressure. And most recently, research has been going into to see the effectiveness of the Mediterranean diet for weight loss. So for this systematic review, a literature review was conducted. And these are some of the key points from that literature review. So first, the incidence of adults who are overweight or obese has been a growing public health problem worldwide. And we all know that as one becomes overweight or obese, we are more predisposed to suffer from different types of chronic conditions. Like I mentioned earlier, the early research into the effectiveness of the Mediterranean diet to reduce weight gain in patients has been positive. A systematic review of randomized control studies sought to determine the long-term effects for weight loss at greater than 12 months in overweight or obese individuals who followed the Mediterranean diet. And the authors of this review concluded that following the Mediterranean diet can be an effective way to promote weight loss, as it was demonstrated in the different individuals that took part in these randomized controlled studies. A meta-analysis of 16 randomized controlled trials that involved over 3,000 individuals determined that the Mediterranean diet could help lower body weight in individuals who were overweight or obese. So for this literature review and overall for the systematic review, the PICO method was used to come up with the research question. And the PICO method looks at population or a problem, intervention, comparison, outcomes, or effects as a way to come up with the research question. And the research question for the systematic review is: how effective is the Mediterranean diet for achieving weight loss and or lowering BMI in overweight adults? So for the systematic review, we have inclusion criteria and exclusion criteria for studies that were to be included in the review. And for the inclusion criteria, we looked at studies that fit this criteria where individuals were 18 years and older, who were in an outpatient and ambulatory care, any health status, who were overweight. The study design preferences for this review were randomized control trials, clinical control trials, cohort, and large randomized observational studies. And I specifically looked at studies that took place between 2009 and 2019. As far as the authorship, we looked at most recent publication by a primary author. So if an author had several publications out, I selected the most recent that related to my topic, and studies were included if they were in the English language. Now, as far as exclusion criteria, for age, younger, if the individuals were younger than 18, if they were in an inpatient or acute setting, health status, patients who had a poor prognosis for their health, Problem or condition, studies that included individuals that were not overweight or obese were excluded from this review. Study design, the preference were obviously I mentioned earlier, but research studies that were not primary human subject fell under the exclusion criteria, as well as studies that took place before the year 2009. Studies by the same author and that had similar content. Studies who were in another language that was not the English language, and animal studies. So these were the different inclusion criteria as well as the exclusion criteria for the studies that were to be included in my systematic review. For the search strategy, I used the databases Scopus and Embase, and with keeping the inclusion and exclusion criteria in mind, total number of articles that were identified were 13. The number of articles that were reviewed but excluded were 6. The number of articles that were then reviewed and met all of the criteria that was mentioned in the previous slide were 7. And on your screen, you can also see the different search terms that I used in the Scopus and Embase databases. So adults, adults overweight, Mediterranean diet, lowering BMI, typical diet, weight loss, and regular diet were the search terms that I used, and they were used in various combinations in both of the databases. So, like I mentioned, there were 7 studies that were identified for the systematic review. However, for this presentation, only 4 of those studies were included in the presentation because I felt that they were the strongest studies, and they also gave a perfect picture of the current research and literature that is out there regarding the Mediterranean diet for weight loss. So with this first study that we have on our screen, Estruch et al. Looked at the long-term effects of an ad libitum high-fat vegetable diet, and as well as Mediterranean diet on body weight and waist circumference in older people who were at risk for cardiovascular disease. The study population were males and females, and a 5-year randomized control study intervention looked at subjects who followed the Mediterranean diet and were supplemented with extra virgin olive oil. Those that followed the Mediterranean diet and were supplemented with nuts, or a control diet, which was basically the individuals were advised to follow a reduced fat diet. The outcome data after a median of 4 to 8 years at follow-up, participants in all 3 of the groups had marginally reduced body weight and increased waist circumference. And the authors of this study concluded that a long-term intervention with an unrestricted calorie high vegetable fat Mediterranean diet was associated with decreases in body weight and less gain in central adiposity compared with a control diet. The second study was Baherska et al., and the study purpose was to examine the effect of 2 energy-restricted diets on body weight and visceral fat loss and risk factors for metabolic syndrome. The study population were postmenopausal women and who had a large waist circumference. So the intervention and the setting, a 16-week randomized controlled trial intervention with the Mediterranean diet or the Central European diet. And both groups lost weight at 16 weeks. And there was no statistical significance in terms of weight loss between the groups, even though both of the groups did see weight loss. It wasn't statistically significant. So the authors of this study concluded that the short-term dietary treatment using the Central European diet or the Mediterranean diet was associated with weight loss in both groups. For our third study, Sophie et al. Studied the effects of a lacto-ovo vegetarian diet compared with a Mediterranean diet, and the study population were women who were aged 49 to 52, and they either followed the vegetarian diet or the Mediterranean diet. The intervention in the setting was a 3-month randomized controlled trial intervention, and the subjects were randomly assigned to either the vegetarian group or the Mediterranean group. The outcome data showed that there was no differences between the two diets in body weight that were reported, and the similar results were observed for body mass index and fat mass. The authors of this study concluded that both the vegetarian and the Mediterranean diet were effective in reducing body weight, body mass index, and fat mass, with no significant difference between them. For our fourth study, Jacks et al. Sought to determine if the Mediterranean diet or a habitual high-fat American type diet supplemented with several key components of the Mediterranean diet reduce cardiovascular disease risk factors compared to a habitual high-fat American diet among overweight or obese adults. So the study population were adults who were between the ages of 40 to 65. And the intervention and the setting, this was an 8-week randomized controlled study intervention where people, the different participants were assigned to a group that followed the Mediterranean diet, the habitual high-fat American diet where they were supplemented with fish oil, walnuts, and grape juice daily. The third group followed a habitual high-fat American type diet, which were the control group. The outcome data showed that participants in the Mediterranean diet arm of the randomized controlled study had significantly greater weight loss despite no significant change in their caloric intake. The authors of this study concluded that adopting a dietary pattern reflecting that of the Mediterranean diet improves weight in overweight or obese adults in the U.S. and may be more beneficial than supplementing the habitual American diets with fish, oil, walnuts, and grape juice. So what did the results show after reviewing the studies that met the inclusion criteria for the systematic review? So the results showed that following the Mediterranean diet was associated with decreases in body weight, and there was also less gain in central adiposity when compared to a control diet. High adherence was associated with the reduced risk of becoming overweight or obese. And the dietary treatment based on the Mediterranean diet principles can be effective in clinical practice as we are trying to help our patients lose weight. And the Mediterranean diet is a good treatment to reduce body fat mass. So the conclusion of this systematic review is that the Mediterranean diet is moderately effective in achieving weight loss and or lowering BMI in overweight adults. When patients followed the Mediterranean diet, they had a statistically significant decrease in body weight and showed improvements in anthropometric measurements. The overall grade that was assigned to the data that was extracted from this systematic review was a grade 1 good. Among the studies that were evaluated, and the reason that this grading was given to this systematic review was among the studies that were evaluated, there were adequate sample sizes in the studies. They utilized random assignment groups. There were few or no systematic differences between the intervention and control groups prior to the start of the interventions. So I'd like to talk a little bit about some of the strengths of the studies that we discussed during this presentation. So one of the strengths of the 4 studies is that all 4 of the studies were randomized controlled design, and as we know, this is one of the stronger study designs. The second was one of the studies reported that they used a homogeneous group, and because of this, they felt that their results were stronger because the group was homogeneous. The third strength, two out of the 4 studies reported a multiple imputation procedure, which they felt was a strength of their studies. And lastly, 2 out of the 4 studies reported that their setting reproduced real-life conditions. Some limitations of the studies. In 2 out of the 4 studies, they use self-reported data, and as we all know, sometimes with self-reported data, subjects can under or over-report, so that data may not always be the most accurate. In 1 out of the 4 studies, they cited that a limitation of their study was the sample size. In 3 out of the 4 studies, the duration of the trial was cited as a limitation. And in 2 out of the 4 studies, they cited difficulty in ensuring dietary compliance as a limitation. So, what does all of this mean for implications for research? Well, perhaps as we move forward in continuing with examining the relationship between the Mediterranean diet and achieving weight loss in overweight or obese individuals, perhaps studies can look at having larger sample sizes in their studies. Second, they can look at longer study durations. In several of the studies that I looked at, they did mention that they thought that the duration of their study was a limitation. And lastly, as of 2018, only 2 trials determining the effectiveness of the Mediterranean diet have been conducted with the U.S. Caucasian population, and so this creates a knowledge gap with regards to how effective the Mediterranean diet can be in treating overweight Caucasian U.S. adults. While the diet may be successful for weight loss in European populations, there is not enough data to determine the effectiveness of the diet in the United States. So I think that moving forward, future research could focus on including more of the U.S. population, because again, a lot of the studies that were reviewed, only 2 of those trials had been conducted in the U.S., and all of the other studies that were reviewed all had European populations. And these are the references that were utilized for this presentation, and I want to thank you all for your time today. Thank you.